Hello, friends and followers. This is Nurses Talking. I am Dale Barzey. My guest today is Mrs. Cannier Jones, who is a registered nurse who hails from the island of Montserrat. So welcome, Jeanette.
Hi.
How are you?
I am doing fine. How are you doing?
I am well. I am well. And thank you for agreeing to speak with me today. I really, really appreciate your time and you sharing your journey with us.
Yes, ma'am. And thank you so much for having me. It is a pleasure to be able to do this.
My pleasure. My pleasure. So I'll start with you like I start with everybody, because I always want to know why people become nurses. So why are you a nurse?
Well, this goes back to, I'm going to say my childhood, very young, at a very young age. And I would go to church and my mom says I took care of all the kids. I would have the tissue to clean their nose, and just taking care of the kids. And she already knew from that start, you're going to be a nurse. And it's just something that I developed that habit too. I loved nursing. I loved people. So it was easy. It was an easy choice.
It was an easy choice for you. Nursing is in your DNA, as I like.
Yes.
Okay, so where did you become a nurse?
Okay, I started out in Montserrat, right after secondary school. And here I was thinking, oh yes, I'm out of school. Went right back into nursing school. And after that, I did, general nursing or registered nurse in Montserrat. Then I did midwifery. So I was a midwife for a while, and then I migrated here. And after which I worked in a couple of hospitals, and I always worked on pediatric floor.
Okay.
And then I migrated to Michigan for a while. After I came back, I got into school nursing because I had small kids. So the time was just right. And now I'm teaching. Teaching high school. I teach 10, 11, 12th graders. We have a CNA program that we teach to, let them understand about the healthcare field and the choices they can make. We only accept students who has an interest in healthcare.
Yeah. So to go back a little bit, when you became a nurse in Montserrat, when you entered nursing school in Montserrat, what were the requirements? As I'm speaking to people who trained in Montserrat, I noticed that over the years, the requirements have changed.
Yeah, it was O levels.
Okay.
I think you had to have at least 2 O levels.
Oh, okay. Okay.
Accepted. And of course you had to be, good stand.
Good moral character.
Yes, ma'am.
We tend to stress that a lot.
Yeah.
Okay.
Because it was considered a very prestigious
Indeed.
job, and so a lot went with it, and you really had to have that good moral character, that good standard, because you were looked up to as a nurse.
Yes, indeed. Yes, indeed. People, in fact, people don't stop calling you Miss Cannonier. They start calling you Nurse Cannier. This is your title out of that.
Your name is Nurse.
Yeah, and you live and die with that.
Yeah.
So coming from Montserrat to the United States, what was the transition like?
Well, when I got here, let's think about it. First, I had to do a test called the CGFNS, I think it's called.
Yeah.
That you have to, that bridge. And the first time I did the state board, I had just come here on vacation. So I wanted to see what state board was all about. Of course, I was not successful, but I came back in the year after when I came to live here. I did a review course. What I figured out was that the registered nurse course consists mostly of psych, a lot of psychiatric nursing. We did psych at home, yes, but not as in depth as, everything is attached with a little psychiatric nursing towards the end of it. So
Mm-hmm.
I figured that much out, did my state board again, I was able to pass it. So, but going into the hospital, the transition was different because here I went to Bronx, Lebanon, which is a bigger hospital than what I was coming out.
Mm-hmm. Yes.
And what the diseases and the diagnosis I was seeing here, I hadn't seen them home. And it was a lot. It was a lot. It was a change. And here was culture coming in because I
Yes.
was working with a lot of different ethnicities, people
Yes.
I knew nothing about their culture.
Yes. Yes.
Here might come in, little person coming from Montserrat, didn't understand Spanish,
Yeah.
Filipino, not even Jamaican patois.
Mm-hmm. Mm-hmm. Mm-hmm.
So I was thrown in the midst, trying to find my way. But I
Yeah.
had good people I worked with on the force. So
Yeah.
it kind of helped you to, get in
Mm-hmm.
the mix.
Mm-hmm. Mm-hmm. Yeah. And it's kind of like sink or swim. And the
Yes.
thing though, with having worked in Montserrat, because I didn't become a nurse in Montserrat, but I was fortunate enough to work in Montserrat for a couple of years. And it helps you to, when it comes to the sink or swim thing, you're gonna swim. It's just that simple. That prepares you for the swimming part.
And it's, as you say, it does prepare you because it teaches you to think. We don't have
Yes.
everything available at
Yes.
that moment. So
Yes.
you use your imagination, you use
Mhm.
your thinking skills, you use that problem solving skill so much. You
Yeah.
don't
You become
realize
an innovator. Yeah.
your place where
Hmm.
you have it and you realize, oh my goodness, this is easy. I have it now.
Yeah.
But when you're in that place that you don't, it is different. Yeah.
Hmm. Hmm. Yeah. And so I see that um, all of your transitions have to do with children, pediatric nursing, school nurse. Now you're teaching in a school. Now you're teaching in a school.
Yeah.
So talk to me about that. Why peds, first of all?
I just love kids, right? And my thing with peds, I love the turnover. Okay.
Okay.
I love to see that the kids come, I do my best, they get better, and they go and they
Hmm.
maybe live another productive life. So, with med surge, they stay. I don't like that. I like my turnover to be fast. And I love to see my kids just get better and, be on the way. And
Hmm.
I think it has also another maternal thing. We had, I don't know if you remember I think back in the late 80s when they had border babies.
Okay.
And so the state would take those babies from drug addict mothers and
Hmm.
they would stay in the hospital. So I've adopted a lot of kids over the years. They're calling you mommy and you buy their clothes, and
Hmm.
you get that bond because kids have a way of giving you that love and the appreciation is different than an adult.
And an adult, and an adult. I have to tell you, it takes a special kind of nurse, from my point of view anyway, to take care of children. I can take care of neonates. I cannot do pediatrics. I do not, I don't want to use the word don't like, but I can't do sick kids. It takes too much. I cannot do sick children. And all of my, I have 3 children, and my thing is, please guys, don't get sick because in my heart, I am no good with sick children. So, kudos to you.
Yeah, I would not function quite well in an adult situation. I don't like med surge floors. I tell my kids, even at school, I say I don't do well with med surge. I don't
Hmm.
like older people, not the bad way,
I
but
get you. I get you.
but I don't know. I just
Yeah,
like kids.
children do it for you.
Yeah, yeah.
That's awesome. Actually, really is. Um, so, what would you say then is your greatest achievement as a nurse?
Oh boy. Let's talk about my education. I mean, one of my greatest achievement as a nurse, my education in Montreal, I could never forget that because
Hmm.
that has led me to where I am now.
Exactly.
And if the education wasn't on par, I wouldn't be able to pass the state board.
Mm-hmm.
I didn't go to school here.
Mm-hmm. Mm-hmm.
And that kind of motivated me to go do a bachelor's, go do a master's, and do something that, I don't know, just it gives you a good motivation. One of the things that I am proud of, I have I was written up in a book, Who is Who in New York? Well, Who is Who in Healthcare? So I
Uh-huh.
thought, oh, that's good. I'm good. I'm in a book. So there's
Okay.
a lot of
What,
things.
what did they have to say about you? I mean,
Well, they
okay.
basically said like my background. I do have
Okay.
there's a video on YouTube
Okay.
created just for me.
Uh-huh.
It's an international nurses
Uh-huh. Yeah.
channel. So
Yeah.
that's one of the greatest things. But let's think, another great thing, touching people's lives.
Mm-hmm.
Um,
Mm-hmm.
we don't realize as nurses, I guess, how many lives we really affect and how
Yes.
people appreciate us, even though they might not say it to our face.
Mm-hmm.
I know we are being appreciated as nurses.
Mm-hmm.
And I told, like when I teach, I said, don't go into nursing or don't go into healthcare if you don't love what you do. And that's so important.
Yes.
And I think, when we do that, when we go in wholeheartedly, we're able to empathize with people, not just sympathize, but put ourselves in their shoes and
Yeah.
really know what they're feeling.
Walk that
And I
walk.
think that's one of my greatest asset is to connect with people.
Yeah. Yeah. Yeah.
So I thank God for that because I'm able to connect. And as you know, in peds, it's not even really about the baby, it's always about the
The
parent.
parents
And
and the
they're the
family.
ones that present the most problem and not the child.
Yes.
So if you're able to connect with people and not only the parent, but the doctors and your co-workers, you've accomplished a lot.
Yeah, you have. Yeah, you have. And if you recognize also that it really is a privilege sometimes to be the person who's there on a day when somebody's having their very worst day. The very worst day, they got the very worst news or things are not going well, and they may lash out at you, but you're the one who's there. Who are they gonna, if they're gonna lash out at, you're the one who's there. And so sometimes you have to learn, you don't take things personally,
Yeah.
you understand, as you say, if you are empathetic and if you can put yourself in their shoes, then it's not even a personal thing.
Yeah, it is a great asset if you can just turn that switch, and it's not about you, it's about that person.
It's not about you. It's not about you.
Yeah.
No, it's not about you.
For instance, peds, something like peds, and you talk about you not wanting your kids to get sick because you don't want, you might not know how to deal with it at the time. But we're thinking about when you have a child that's dying.
Yes.
Or a child dies on a
Yes.
ped.
Yes.
It's not only traumatic for the parent, it's traumatic for the nurse.
For you too, yes.
So
yes.
what we used to do, we would go into the doctor's office, they would have their office or go into our office and we cry.
Yeah. Yeah.
We cry.
Yeah.
The doctors cry. We as nurses, we cry and then we wipe our tears and we come
and you go out and you do it again.
Better now, so we could react with that patient and give that support. But we feel it as much as them.
Yeah. I know you do. I know you do. So now we've had this whole pandemic, a whole year of COVID, and how has that affected your practice?
Oh, you wouldn't know how much. It's been a roller coaster. So now we came out in March. We came out I think we came out just like on the weekend, and they say, well, you know, you might want to take some things home with you because we're not sure. Then the call comes Monday, don't come in, we're locked down. You got to go remote. And you got to go set up your classroom. And we're like, what? Who? What?
How?
Yeah. So now we ended up on Zoom. We started Zooming, and we had to change eventually because Zoom and go to Google Meet. You know, because it wasn't as safe as it is now. So a lot of things were happening with the kids. But for me, I mean, I do. I mean, I did the computer for a while, but now I'm learning peer deck, informative, this, that, you know, and I'm like, what is going on with this picture? So for me, it was a learning tool, but it was hard.
Yeah.
It was hard. And at the same time, I'm using this forum to keep my children's interest.
Yeah.
So here am I going all over Google to find stuff that would, you know, interest them and hold them together.
Yeah.
And at the same time, we're talking nursing, we're talking skills.
Yes. And how do you get them to practice these skills?
Yeah. So in my home, I would do the videos. So if we're doing something like moving the patient up in bed or turning my patient, I had my little room and I had my bed, and I would have my son. My daughter would sometimes volunteer to be the patient, and my son would be the videographer. So, so I made videos and put them on their forum, you know.
Yeah.
Meet, and they would make theirs and send it back to me, and then I would evaluate it. Then now I learn about breakout rooms, so we're going to breakout rooms and we'll do the skill one-on-one.
Yeah.
So it set us back, you know, it set us back a little bit. You know, what I would do in the classroom with 6 people, I'm now doing it one at a time.
One-on-one. Yeah.
But from last year, October, I started going into the school twice a week to do skills with them. And then now from January, no, March, I am going in 4 days a week.
Okay.
Hours and take care of the skills part.
Yeah. So we're getting back to some kind of normalcy, although I don't even know if we're going to know what that is. I think we should stop using the word normal because you know, who knows what that is? Who knows what that is? Yeah. So when these kids that you're teaching, when they're finished, do they have some kind of certificate?
So what happens when they? So we started 10th grade. So 10th grade, we give them basic nursing. You know, I mean, history of nursing.
History,
how it started, the plagues, all that. So they get the basic background of how nursing started. Then we do things like infection control and, you know, all of those things will come all into 11th grade. And then we start teaching them about the bed making and all those, you know, skills that they need to know. Then when they get to 12th grade, they do bed baths, they do all the whole skills set. And then they go to a nursing home we affiliated with, and they do their skills there with the patients. And at the end, so now what happens is in 12th grade, coming down to about May, we book with New York State.
Okay.
So New York State comes in and sends a proctor to the school, and these girls do their written and their skill tests, and then they become certified nursing assistants.
I see. So when they leave, they can, they already have that. They don't have to go look for that kind of skill if they wanted to get into. So of those, are a lot of people using it as a stepping stone to become nurses?
Yes, and we even have students that left the graduated at 12th grade who are in medical school.
Okay.
This program is about maybe 15 years old now, and we have girls who have double masters. And I'm like, are you for real? So
of course.
they are using it. And over here we have colleges like Malloy, Adelphi, Hofstra. So these kids, the CNA is like a prerequisite. It's a step into nursing school.
Yes.
So I mean, that's why we say, if you don't want to do something in healthcare, it's not advisable to come and sit 3 years and do this. You should want to continue.
But also, I think one of the things with that also is that although it's a basic kind of skills thing, it does open you up to all of the all of the different facets that healthcare itself has to offer anyway. So that's awesome. That's awesome. So is this program throughout New York State, or it's just on Long Island? Or
no, Long Island, I think we have maybe two other schools. Most they could go to BOCES and do this program.
Yeah.
But in school, maybe about 2 or 3 schools. I think they may have 2 or 3 schools in Queens as well, but it's not.
It's not a very, okay.
Yeah.
Yeah. So awesome. So I've been asking this question now. What is your biggest wish for nursing and nurses going forward? Seeing as last year, coincidentally, was the year of the nurse and midwife. Prior to that, I'm not saying nurses were not appreciated, but I don't think that people actually saw, or people in the general public actually saw as much of what nurses do as they had the opportunity to see last year. And nurses themselves had the opportunity, I think, to recognize that we're doing more than just a job, that we are, a powerful group, politically, health-wise, all of that. So what do you see for nursing and nurses going forward?
I would think, well, you hit on a good point, because you said last year, and because of the pandemic, we know that nursing has kind of gone up the ladder. And I think as nurses, we need to promote ourselves.
Yes.
And we need to let people know what we do. We're not just a nurse. Some people come and say, well, I don't know, I'm just the nurse.
Yeah. And
no, you're not. You are the nurse.
Exactly.
Different. I mean, you're saying the same words, but it has different connotations.
Exactly.
So we have to stop saying, I'm just a nurse. I just work here. I'm just. You are the nurse. And when we learn that we are important, I think that makes a difference. So what I want to see, like for my generation that's coming ahead, know how important you are to healthcare.
To this whole system.
Whole system. Well, we say doctors, I'm saying, oh my God, that's so important. A doctor is not more important than a nurse. And when it comes to nursing, you have to understand, you got the hangle, sister, you got it. Doctors come to you to find out about the patient.
Yes.
So you are important. I mean, the patient is the most important, but you are the most important, second most important, if you want to call it like that. So I want us as nurses to realize how important, realize our contribution to healthcare.
Yes.
And if we know that, our self-esteem, we pick ourselves up and be proud.
Yes. Yes, and that is one of the goals of me doing this and talking to nurses, because I really want to showcase nurses and showcase us as who we are. We have this thing that, because as I went up the ladder and whatever, what my realization was is that everybody's job description was part of my job description. And I mean everybody, I'm talking from housekeeping,
Right.
everybody's job description was my job description, including my job description. And somehow we think that we have supposed to be spread ourselves thin and um, not be, just take on everybody else's thing and not use the power that we have as nurses, and so we give away power a lot. And I really don't like to see that happen. I really like us to understand that we are nurses. We're not maintenance, we're not housekeeping, we're nurses, and we are powerful in that role.
Yeah, and you have to understand you are a professional person.
Yeah.
And I think that's something that we downplay.
Uh-huh. Mm-hmm.
You went to school for 6 years, you went to school for 8 years. You are a professional.
You are a professional person.
And so you need to carry yourself in a way that that you have to know that you are, it's not the other person, it's about you.
It's about you. It's about you, and you have standards.
Yeah.
You have standards, and when people see you coming, they have to see that you have standards.
And I don't know if you remember when you in Montserrat, when you wore your uniform and you put that cap on your head, you just got 6 feet tall, because everybody that's around you respected you.
I know.
And you were placed on this little, not the high one, but a little pedestal. And you know that you had to be, I'm a nurse, I'm important.
Yeah.
And I think we take it for granted. We take it for granted. We're not, we just do, I don't know, we just take it for granted. We don't recognize our worth.
But I think half of that has to do with the fact that nursing is a female-dominated industry. And as women, apart from as nurses, as women, we just take it for granted that we have to do for everybody else.
Yeah.
And so we bring that into the nursing thing as well, which is, a disservice to ourselves and to our profession, I think.
Yeah. We got to recognize ourselves. And I'm right now, when my kids wear because they wear scrubs, right, on their and their white shoes and their scrubs, and you have to have your nails a certain way. But miss, when I go to the hospital, the nurses they're red and they're long, and I said it doesn't matter. What matters is that you do what's right.
Yeah.
And I say when you're in the hallway and I see you walking in the hallway, you should respect the scrub that you wear, because you are a professional now. You're in a different category to the ordinary student. So then I'm trying to teach them that nursing, for me, nursing, I'm proud to be a nurse.
You're a cut above. Yeah.
I'm just proud to be a nurse. There's certain things nurses can do that nobody else can do.
Yes.
So why are you not proud? So just be proud of who you are. And because you have that pride, I'm a nurse, I'm going to do everything right. I say, when I do something, my name is on it.
Yes.
This is done by Janet Jones.
Yes.
Okay, so it must be done right. So if you have that pride, I'm trying to instill that in them, because this generation is a little different. Yeah, a little different. So I'm trying to instill, good values. Hey, I'm wearing my uniform, so I can't be fooling around. I have to take myself in a, respectful way.
And you have to take it seriously.
That has to come back. Into nursing, you have to respect yourself. You got to respect each other. You got to respect what we do.
Yes. Yes, indeed. Yes,
Yeah,
indeed. Yes, indeed. And also, I think in addition to that, recognizing that at any time the roles can be reversed and you can be the one on the receiving end. And what would you like for you? What would you like for you?
I smile because this is always my I don't want to say my recommendation, but this is always something that I always believed in. You do not know when your day will come. And so when I do things with the kids, I said, be gentle or do this way. I say, it could be your mama,
Mm-hmm.
it could be your auntie, and
Mm-hmm.
it could be you.
And it could be you.
So you have to always put yourself in the role like, well, do I
Yeah.
want this to happen to me? Do I want to
Right.
feel it?
Yes. Yes. Yes.
And if we won't be that rough if we think about it, you know.
Yes. Yes. Yeah. Yeah, I know. We wouldn't be that off. And and so I
And
found out one
we
point.
do have some, but
Yeah, you know what? And sometimes I understand it and I have to, you have to restrain somebody sometimes. Sometimes I just say to people, listen, go take a break.
yeah,
Because sometimes you do have to just go take a break.
yes.
Uh,
Otherwise, the break will take you.
Go take a break. All right. Go bring your blood sugar up is what my usual thing used to be. Go bring up your blood sugar. So with all of this,
Yeah.
and the thing that I think is more important as we talk to nurses and what we do, what do you do for self-care and relaxation? Because to me that's just as important as everything else you do.
Well, one thing I picked up from home, I crochet.
Mm-hmm. Okay.
So I still do my little crocheting. I listen to music. I love to sing. I listen to music, and I don't do as much exercising as I should, like going for long walks and those kind of
Yeah.
things. I do it occasionally. But sometimes I get inspired. I do aerobics, but it's not a constant thing. I just take nice long baths and just chill.
Yeah.
Sometimes
Yeah.
you need to just lay down, read a good book,
Mm-hmm.
and just relax.
Yeah. 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 Yeah.
Go to the spa and just get that treatment. It's so good, girl.
I think it's not even so much important what you do, as long as you recognize that what you're doing for you. Whether it's walking, reading, just doing nothing, watching. There are days when I have what I binge on TV trash, watching nonsense on TV, stuff that does not require any kind of brain power or anything. But I think it's just important to recognize that whatever it is you're doing, you're doing it.
We all need
You're
a
not
mental
doing
health day.
You're not doing it because somebody else wants to watch this program. You're not doing it because anything, just for you.
Yeah.
I think it's important to do that.
One of our things we always say, I'm taking a mental health day today.
Yeah.
It's
Yeah.
okay to just chill,
Yeah.
relax,
Yeah.
get up late, take a shower, don't do nothing,
Yeah.
and we all need that.
Yeah, we need that. And we need that. And we need to recognize that we need that. So
Yes.
many of us don't recognize that we need that. And we feel guilty if we do it.
Yeah.
Don't feel guilty. Don't feel guilty at all. Feel guilty if you don't do it.
Yeah.
Feel guilty if you don't do it.
Yes. Yeah.
So any words of inspiration for anybody looking at this?
Well, I want to say, if you want to do nursing, it's a wonderful opportunity. It's a wonderful job. Basically, you just gotta love what you do, and once you get into nursing, you don't have to do bedside nursing. There's so many different avenues, so many lanes, so many whatever you want to call it, tracks, so many ways and different things that you can do in nursing. That you don't have to just do bedside nursing.
You don't at all.
And that's amazing because where I grew up, I only could do a few things, and I was exposed to those few things earlier, but I was still happy that I knew how to scrub for the OR, work in the ER, be a midwife, work in med surg, work in peds. So I had that wealth of experience still. So when I teach, I could still have that experience, and share something with the children. So if it's something you love, go into it. Once you get into your 4 years, after that, you can always choose, what realm you want to go in. And there's so many areas you could end up DNP, so
everywhere.
You don't have to just
everywhere.
You could just do nursing, but always be able to empathize with your patients. And once you could put yourself in their position, it makes life a whole lot easier for you. So, I mean, there's nothing else I would choose. I mean, when I was growing up, my second choice career was law.
Okay.
Right? But it didn't pull as much as nursing did. So I just stayed with my nursing. So, I mean, you could handle it. I mean, and even then I could have gone on to do another part in nursing that deals with law.
With law,
so
yes, indeed.
Combine, you could combine careers. And that's the thing. You have the opportunity to do what you have to do, First of all, know what you want to do and then go for it.
Yeah. And even sometimes if you only have an inkling, because it's so wide, even if you haven't just an inkling, perhaps you could still, because it teaches you about, I keep saying this, it teaches you about you. It teaches you about what you can handle. It teaches you about how you think, how you see people, how your ability to compartmentalize or to assess. It teaches you so many things about yourself that it's amazing. In and of itself, what it teaches you is a wealth. It's a wealth of knowledge. Forget about what you're learning about nursing itself, what you learn about life in general, and you yourself is amazing.
That patience thing, you never realize you have
it.
Amount of patience. It just grows on you. And you learn, and you're not as sharp-witted. You learn to hold that tongue, and it's just amazing. It's just amazing the amount of things that you learn. It matures you.
Yes.
It really matures you. And gives you a different outlook on life. You don't take life callously. You're serious with life because you see what can happen. And
it's facing, especially for nurses who are your thing was a quick turnover. But for nurses who are in a longer term, nurses in long term and stuff like that, it's every single day they face their own mortality every single day, and that's tough. That's tough, and it teaches you to just be.
That's one thing I as we say, tip my hat to those people who worked in COVID in the hospital.
Yes,
it must be traumatic. There's no way you're going to tell me it's not.
It is trauma, yes.
Trauma for them, a mental trauma. And I think that they should all go into counseling.
It's interesting you say that, because I had that conversation just yesterday. I was saying that once this whole thing once we've gotten a handle on it, and it's not so pressing and it's not so much in the forefront, we're going to realize that our quote unquote frontliners, or people who have been there all along, need a lot of help. Going to need a lot of emotional and mental, and they're going to need a lot of help just to stand.
Because I had one friend, and she was like, I would leave them in the afternoon and they looked fine, not perfect, but they look fine. And when I come back in the morning, the bed is empty. And I go, where's that person? Where did you transfer them? Deceased. So can you imagine that shock? Every day you're going into the same thing. It's not easy.
And it's replicated several times a day in your shift.
Mhm. That's a lot. That's a lot. That's a lot. That's a lot.
Yeah.
I mean, families are dealing with it, and we're all dealing with it in some way because when you can't move around the way you want to, and you're always wearing a mask, and you always have to tell somebody 6 feet, social distance, because they want to be under you, like it's almost
Yeah,
like you're being now,
yeah,
So, it is a trauma to be dealing with every single day.
yeah, yeah.
So.
So we're gonna have to figure out ways to deal with that and take care of one another after all of this.
Yeah.
So listen, I want to offer you my thanks for talking to me today. I truly, truly appreciate it. You're sharing so much. And I hope that people watching this really got something out of what we talked about today, because that was the goal. And so thank you so very much for your generosity.
You're so welcome. And anytime you need me, I'm available.
Okay, thank you.